Are you stuck in between Medicare Advantage and Medigap supplemental for your Medicare insurance? And could you use some simple and basic guidance as to what would be the right choice for you? Because we can certainly help. Hi, I'm Tommy at medicalinsurancetoday.com. In the state of California, generally you have two roads to travel. You got Medicare Advantage, less monthly premium, and a more restricted doctor network, or you go to Medigap supplemental. These are the traditional supplements, and that's what I want to talk about today is Medigap supplemental. Medigap supplement is the traditional insurance. It costs a monthly premium where Medicare Advantage generally in California does not have a monthly premium to pay for that policy. So what you're buying in that Medigap supplement option is the freedom to go to any doctor, any hospital, any facility nationwide without a referral and without any permissions from your insurance company. You're paying for that freedom of movement between doctors and your healthcare. So folks that will fit into a Medigap supplement, typically you're looking at plan G as kind of that top level plan. NKL, as you go down in monthly cost on those Medigap supplements, you start to take on more deductible and more cost when you go to the doctor. So plan G is kind of the lowest deductible, highest level plan, and it has the highest premium. At the age of 65, Medigap Supplement G is going to run you a couple $100s a month, and those premiums do increase over time. My mother-in-law is about to turn 73, and her Medigap supplement over 8 years has gone up to about $300 a month, and that will continue to increase over time, as all insurance does in the Medigap supplement world, I should say. And she's super happy with her insurance. What she's paying for is that freedom of movement. People that are going to fit into Medigap supplement plans, number one, have the resources or money in their retirement to afford these additional premiums. Two, they have the necessity to see any doctor that they want to. They want to have that freedom. They want to choose their doctor. They don't want a primary care doctor telling them what specialist they're going to go see, and they want that flexibility. Lastly, are folks that spend a lot of time out of state or in different geographic locations than their retirement. If you're traveling, if you're a snowbird and have property in another state, if you're a road warrior and living out of an RV and traveling across the country, a Medigap supplement probably would suit you because you're able to go to any doctor in any state that, as long as they accept Medicare, they're required to accept your insurance. So that gives you a lot of freedom and a lot of flexibility, but you're paying a premium for that. And that's the measuring that we do here at Medical Insurance Today, is make sure we're talking with you in great detail about your needs, your requirements, what's important to you, what budget you're working within, and who you need to see for care as you age, to make sure that you have access to that care and that it's affordable for you to continue on into the future. So if you're stuck between Medicare Advantage and Medigap supplement, could use some guidance. We don't charge any fees to help you. We would love to guide you through this, and we're very, very good at what we do. If we can help, please be in touch. medicalinsurancetoday.com, and we look forward to serving you.